Hello, I'm Matthew Koffenberg, physical therapist and owner of Back in Motion Physical Therapy. I am so excited. The snow is melting, the sun is shining, we can finally get outside and be more active. Now, along with being more active, unfortunately, that can create more potential for injury. So when there's no snow, a lot of us get out and we start walking and we start running. So I thought today it would be appropriate to talk about one common overuse injury in walkers and runners. That injury is called IT band syndrome. So what exactly is IT band syndrome? A lot of us have probably heard that term. IT band syndrome, quite simply put, is just an irritation or an injury to the IT band. Now, the IT band stands for iliotibial band. What is the iliotibial band? So the iliotibial band, if we look at my drawing, we're going to look at someone from the side. This is their leg from the side. The IT band is a big piece of connective tissue. It's not muscle, it's not tendon, it's connective tissue. So connective tissue, as the name implies, connects two things. So the IT band connects our pelvis to our knee. So again, if we look at the anatomy, so the blue here is representing the IT band. Again, it's a very big piece of tissue and it's very, very strong. The IT band has attachments. So this up here is representing our pelvis or our hip region. So the IT band has attachments to the gluteal muscles or the buttock muscles. So the buttock muscles come in and blend into the IT band. And then at the front of the hip we have a very small muscle. It's called the tensor fascia lata. But the tensor fascia lata also blends into the IT band. The IT band then comes all the way down the outside part of our thigh and actually comes down and attaches to our lower leg, which is called the tibia. Hence the name iliotibial syndrome. So this IT band attaches the pelvis down to our lower leg. It provides some stability right at the knee. So when we talk about IT band syndrome, the most common complaint is outside of the knee pain. So if you were to just put your leg up on a chair, most people will complain of pain right here, right on the outside part of their knee. And most of us can actually feel our IT band. So if you kind of rub your fingers back and forth, up and down, you'll feel this really thick, hard piece of tissue. That is your IT band. And remember, the IT band starts at the knee and it comes all the way up the thigh and attaches right at the pelvis. So it's a large, large piece of tissue. That IT band will get irritated when our femur, so the femur is our large bone of the leg, when the femur rotates inward, the IT band will get squished. So this drawing is representing that. In a normal situation, we've got our IT band, so this is looking straight at the front of the knee. The IT band is coming down and attaching to our lower leg. And this is our femur bone. In between the IT band and the femur, we have a fluid-filled sac called a bursa. So normally the femur is going to stay very level. However, if the femur rotates inward, it's going to squish the bursa and it's going to rub then on the IT band. And that IT band then is going to get really, really irritated and inflamed. Why does the femur rotate inward? It'll rotate inward for a number of reasons, but the two most common reasons the femur bone rotates in, number one is a pelvic tilt. And the pelvic tilts, remember our pelvis is here at our hips. When we're running or walking, every time we land, my pelvis should stay very, very level. However, sometimes it'll tip. When it tips, it drives my femur inward, rotating that femur. The pelvis will tilt if we have a weak butt or if we have a weak stomach. The job of the butt and the stomach is to keep my pelvis level every time I land with walking or running. If they get weak, femur is going to rotate inward and we can irritate the IT band. The other main reason for the femur rotating inward is if we have too much pronation. Pronation is when our foot, so if this hand is my foot, the outside of my foot, pronation is when I land and my foot rotates in. That's normal, but what can happen is the foot can rotate in way too much. That's too much pronation. When that foot rotates in too much, it causes the femur to rotate. and again, causing that irritation on the IT band. Really, really important if you have this outside of the knee pain to talk to a physical therapist, because a physical therapist can do videotape analysis of your walking and your running, can really figure out why you have IT band syndrome. Once you figure out why you have the pain, you can fix it easily. Please give me a call if you have any questions at 218-346-2464.